Hi everybody, this is Christine. So I'm going to demonstrate the two skills of flushing an adapter and doing an adapter cap change, as well as a central line dressing change, okay? Because a lot of times you will do these at the same time sometimes. So anyways, that's how I'm going to do it, okay? So I've gathered my supplies. I've made sure the order makes sense for my patient, and now I'm going to go ahead and go to my patient's room. So knock, knock, knock. Hi Dan, my name is Christine. I'm going to be your nurse today, okay? He says okay. All right, so it has been, for central line dressing changes, we should do it within 24 to 48 hours after the initial placement. And then every 7 days after that. The caps get changed roughly every 7 days, unless they're used more often and they get to be, maybe we've used viscous medication in them, or they're starting to look kind of gunky and stuff like that. So we'll do them more frequently if we need to. If there is a gauze dressing underneath the central line, typically hospitals will have some type of policy that says to change them about every 48 hours. But otherwise, if there's no gauze or anything underneath it, you're good for 7 days. So I come into the room, I introduce myself to Dan. Dan says, hello. Dan, before I get going with things, can you just verify for me your name and date of birth? He says, Dan Brown. The date of birth matches the wristband. Perfect. Are you allergic to anything, Dan? He says, no. So great. Okay, so a couple things that I need to do while I'm in here right now is I am going to go ahead and do your central line dressing change, as well as we're going to change those one of your adapters on one of the caps on your adapters, okay, adapter cap. He says, okay. So I go ahead and wash my hands. So Dan, have you had your central line for a while? Oh yeah, about a week. Yeah, so we're going to change it about every week, unless we have to put gauze underneath it, you know. I'm just making chit-chat with them on, making sure my hands are dry. So I think what I'll do first is I'll demonstrate how to do the cap change, okay? So I've washed my hands, I put in clean gloves. Every time that I'm going to work with a central line, I'm just taking note of what the site looks like, if there's any redness, any swelling, any drainage, anything like that. Your central line site looks good. Have you had any issues with it all, Dan? He says no. Perfect. Okay. So I've got a 10 ml syringe that has 5 mLs of the 10 units per ml of heparin in it. And I'm going to use 2 mLs to prime my adapter. And then after that, I'm going to keep the remaining 3, and that's what I'm going to use to flush with, okay? I'm going to go ahead and open it up. I'm going to prime it. Usually I'll make a little bit of a mess here. Good, I'm at my 3. I usually like to take it out as well and maybe loosen it a little bit, just so it's a little bit easier for me to get that end off. And I just put it there for safekeeping. All right. So like usual, if you're changing the caps or the adapters, you would typically change all 3 at one time. But I'm just going to demonstrate how to change one of them. So instead of using your alcohol at the very end, right? What I'm going to do is I'm going to put it up here. I'm going to make sure that all of my clamps are clamped, because I'm going to end up taking this cap off. And if I don't take that, if I don't clamp it and I just take the cap off, I leave that open to air and I risk air emboli for my patient. So I want to be very careful and make sure my clamps are clamped. And then I'm going to take my alcohol swab and clean at the connection site, not at the end, right? Because this doesn't matter right now. So I clean that really good. Going to go ahead and twist it off. And I probably should have chose one that would come off a little bit easier. Sorry about that, guys. Let's see if this one will. Maybe the 3rd time's the charm. There we go. This one was going to come off for us. I'm going to go ahead and throw that away. And then I'll still take my alcohol swab off. I'm not going to touch the very end of it, but I might notice that there's some gunk sitting right in those ridges. So I'm going to clean that off real good, okay? There we go. Get rid of that. I've got my adapter that's all primed. I go ahead and twist it on there. I unclamp it. I'll pull back a little bit just to make sure I got blood return. And then I'll go ahead and I'll pulse flush that heparin heparin in there. Good. Clamp my line, and then go ahead and disconnect my syringe. So now I've got a clean end cap on there, or adapter, okay? So, we've got a new adapter, and like I said, you typically change all of them at one time. So Dan, the next thing that we're gonna do is I'm gonna change the dressing that is on your central line, okay? He says, yep, sounds great. So right now I'm already wearing a mask, which you would not have to do with just the changing of the adapter, but it's coronavirus time right now, so I'm wearing a mask. I'm dying, it's hot. So normally I'd have to make sure that I gather a mask, okay? So I don't want that to confuse you later on and you enter a room and then you don't have enough supplies. So you need to make sure that you have a central line dressing change kit. If it is the policy of the place you work to have like a Silvasorb, it's an antimicrobial disc or antimicrobial patch that will go over that insertion site just to help prevent any kind of microbial growth. So if it is a policy of the place that you work, you'll need to grab that. Like I said, you'll need a mask for yourself. Sometimes I'll bring in 2 right away, 1 for me, put 1 on the patient. Otherwise, there is 1 mask in a lot of the kits, okay? Sometimes there's 2, but not always. And then also, I want to make sure I have a culture swab because if I'm looking at this site and there's anything there that I see, any kind of drainage or anything, while I have the dressing off, I might as well get it right then and there and ask the doctor then if he wants me to send it down to be cultured, okay? So I have my supplies that I need. I haven't left the room. Dan is okay with me doing his central line dressing change right now. So what I do is I go ahead and open up my kit right away. And every kit is a little different. So that's why I open up my kit right away, because I'm wondering what I got going on. So I think with this one I can pull it all out of here. The tail. And I see I've got adhesive tape remover in case there's any tape, or yeah, any like kind of adhesive that's stuck underneath my tape here. I can use that. I've got my sterile gloves. Oh, this kit was nice and it gave me 2 pairs. You won't always have 2 pairs. So it's always a great idea to bring an extra pair with you just in case. And here it's got our 2 masks for us. So again, depending on how you prep, you're either going to need to open up your kit right away to get the masks out, or you're going to have to bring masks in with you. Okay, so we've already got masks on. All right, so I have already touched this a little bit because I was trying to figure out how this kit works. So I'm going to go ahead and open it up all the way so that when I put my sterile gloves on, the only thing I'm going to touch is sterile, and I'm not worried about anything else that I possibly touched with these gloves. There we go. All right. And then again, remember, make sure that your sterile field is kind of all in your visual field, okay? You never turn your back to it. So if I use these to do the cap change, obviously I would take off my gloves, wash my hands, put a new pair of gloves on, okay? So let's take a look here again. I'm looking at the site, making sure there's no redness, swelling, drainage. I would take note of that. Here I would go ahead and start taking off my Tegaderm, okay? I'm going to start just by kind of rolling up the edges here to get things loose. And then when I'm actually taking the tape off all the way, what I want to do is I want to make sure I pull it off in the direction that's going in. Like I don't want to pull it downwards because I don't want to accidentally pull that central line out any. And usually these central lines are sutured in place, but ours isn't. So anyways, I want to pull in the direction that it's inserted, okay? So again, taking a look at the site, if I needed to gather a culture, I would go ahead and gather my culture right now of that, okay? If I need to use my adhesive, I could use my adhesive and clean it up and stuff, but it looks real good. Any pain or anything like that at that site, Dan? He says no. Okay, great. So I've got my gloves here. I've got my culture that I took and set aside. This would be the point where if I've got an antimicrobial disc or patch, I would need to open it up and put it into my sterile field. This one, since I've used it for demo a lot, it doesn't want to come out, but let's see if you can get her out. Not typically what you want to do over your sterile field. When you don't reuse them, then they come out nice and easily, but There we go. So, because otherwise you don't want to be touching that, right? All right. So I'm going to go ahead and take off my gloves. Use a little bit of hand sanitizer here. And now I need to put on my sterile gloves so that I can go into my sterile field. If Dan wasn't able to tolerate wearing a mask, I could ask him to just keep his head turned to the side away from where his central line is, so that he's not breathing any kind of bacteria on it. And I would explain that to him when I put the mask on. I'd also explain I'll be wearing a mask for that same reason, so that we just don't bring any bacteria to that site. All right. All right. So again, remember how to put on sterile gloves. Back away so that you're not over. Always keep your hands up above the waist. Good. The other hand. Okay, perfect. So now I can go ahead and play, I shouldn't say play, but go into my sterile field and do what I need to do, prep what I need to do. Some of them come with a little bag, we don't need that. So every kit is going to be a little different, but the premise behind it is all the same, okay? So don't let that throw you off that things look a little different. They all should have some kind of core prep so that you can clean the skin real good. They all typically come with a gauze in case you need that. This one actually comes with a skin protectant swab stick. Some of them come with like 3 sticks so that you can then clean the lumens afterwards, so different things like that, okay? So I've got out of here what I need. I've got my core prep. The only thing I'm not seeing right now is, there it goes, this is my tegaderm. So let me go ahead and open up my tegaderm just so it's ready for me afterwards. Mind your 1-inch border, don't forget that, okay? What is that? There we go. All right, so back to my core prep. All right, so I want to make sure that I clean the insertion site really good, and I'm going to use a back and forth motion, create a little bit of friction, and I'm going to clean the site for about 30 seconds, okay? If I have to stabilize it with a finger, I would. I'd probably use like my middle finger or a finger that I don't use a lot to touch things. But like I said, it's typically sutured in, but maybe those sutures are a little loose and you're getting a little, I don't know, frisky with your back and forth motion. So I start at the center, work my way out, making sure that I get all the areas of where my tegaderm is going to cover. Okay, and I might do the tubing a little bit there too, just because once I cover it with my tegaderm, obviously I'm not going to get back to that area. Boop. All right, then I would wait for that to dry. Okay, it's going to take a long time for our mannequin to dry here, so we're going to go ahead and say it's dry. If you have an antimicrobial disc, this is where you'd grab it. These are a little tricky to work with, I'm not going to lie to you, because you kind of have to touch down in order to get it to stay for the majority of the time. Okay, so that's why if I had to hold the central line in place while I was cleaning it, I would use a finger that then I wouldn't use again at this point. So fingers, and I would go ahead the best I could to lay it on the site. We try to get that other little tab under, but if you can't, you can't. Okay, it's on there. Next, I'm just going to go ahead and grab my tegaderm and lay it over the site. And you kind of want your insertion site right in the middle of your tegaderm. Okay? Lay it down nicely. I'm going to take my tabs off. Now I don't have to worry about being sterile anymore, okay, because that whole side is covered up. Now I can just take, if you had like the 3 swab sticks that were alcohol swab sticks, you could take those and just use them again to clean down the lumens. But again, this isn't sterile anymore, right? So I get those nice and clean. I could take my tape then, or whatever comes in my kit. This has these nice little strips like this. I could use a strip to then stabilize my lumens in place. I just put it across the 3 lumens just so that they're nicely separated, and it's just nicer for the patient. Okay. There we go. There's also a lot of times in these little kits a little kind of like a label that you can use then to put your initials, the date and time on there, but you are going to document. Okay. So after I got this all done, I could go ahead and remove his mask. I could remove mine. I'm going to go ahead and take off my gloves, wash my hands, make sure he's in a comfortable position, call it with a reach, that he doesn't need anything, okay, that his bed is in the low position, that he's safe, basically. I'm going to document how he tolerated the procedure. I'm going to document that I did the central line cap change. Like in this case, since I only did one, I would be sure to clarify that it was the distal lumen. And I could even use the color if I wanted to describe it, but if I typically, you change all 3 at the same time, or however many lumens it is, you're going to change them all at the same time. That I did that, and that I flushed it with 3 mLs of the 10 units per ml of the heparin. I would document that I did the central line dressing change, that I did it in sterile fashion. I document what the insertion site looked like, if there was any redness, drainage, swelling. If I got a culture, I'd document that the culture was sent. Let me think here. I would clean up my area before I go. And yeah, again, just wash my hands if I touch anything again like I am right now.